Hello, my name is Taylor Walker. Thank you for your interest in my article titled The Relationship Between Substance Use, Strain, and Depression Among College Students. This research is based off my capstone project I performed when I was an undergraduate student at the University of Georgia. To give you a bit of background on this project, I started it because of the opioid epidemic that really became a major problem in America during the late 2000s and early 2010s. So during that decade and up to this moment still, America has faced a major surge in prescription drug abuse and drug overdoses as well. Drug use and stress among college students has also increased within the past few years as well, and with that, rates of depression have increased. So I pursued this project because little research has been published concerning the relationship between Agnew's general strain theory, their concept of strain, depression, substance use, and the dearth of literature surrounding this framework. To give you more background on general strain theory is a offshoot of Martin's strain theory by sociologist Robert Agnew. It focuses on the everyday life strains that contribute to delinquent behaviors and also internalizing behaviors as well, such as depression, anxiety. Agnew argues that strain can lead to internalizing behaviors like depression and anxiety, as I just stated, and externalizing behaviors as well. This can be substance use or crime or aggression. And according to Agnew, strain can come from three sources: the loss of valued objects or positive stimuli, the presence of negative stimuli, and the inability to achieve a desired goal. This is sort of the theoretical framework that Agnew postulates through his research. So you have the three factors that lead to strain, and which leads to depression and substance use, which are the variables in this project. To give you a bit more background on trends in substance use among college students, the prevalence of illicit substance use among young adults was around 20% in 2013. And young adults tend to report higher rates of substance use when compared to other age groups. But few studies have been conducted as of today regarding the effects of the opioid epidemic upon college students. So as you can see from this graph from the CDC, overdose deaths have increased from 1999, when there were only around 17,000 a year, to 70,000 in 2017. So this is a major area of concern that really hasn't experienced much research for this demographic and age group. Moving on to the literature surrounding depression in college students, contemporary studies suggest that college students are experiencing a major mental health crisis, and that students face far higher rates of depression than the general population. This is also evident by the counseling services that are on many campuses that students tend to seek out when experiencing concerns with mental health. Linking it back to general strain theory, there's a rigorous relationship between strain and depression that's been established in the literature, but this relationship hasn't really been examined or tested between strain and substance use. So the goal of this project is to examine where the relationship between strain and substance use is mediated by depression, as depression is often a factor that can lead to substance use. So to carry out this project, I used the Beck Depression Inventory, the Drug Use Screening Inventory Revised, and the Drug Abuse Screening Test. My hypothesis for this study was that the effective strain on substance use will be mediated by depression. So the participants for the study were almost 600 undergraduate students between the ages of 18 to 25 from a large southeastern university. Students were invited by email to fill out an anonymous survey, and data collection took place over the course of 2 months in fall of 2018. To give you a better, perspective on what my sample or who my sample consisted of, the sample for this project primarily consisted of females, mainly white females who were also middle to upper class. The students that were surveyed were also primarily upperclassmen, so in their third year or beyond. And again, there were not very many racial or ethnic minority students that were surveyed in this project. So going into the survey results, around a majority of participants reported feeling stressed over the course of the past year, but a majority of students also reported experiencing little to no depression within the past year as well. The most commonly used drug among students was alcohol, followed by non-prescription pain relievers, and then marijuana. Less than 5% of the sample reported using a prescription opiate within the past year. Moving on to correlations between variables. It's important to note that when viewing the stress as the stand-in for strain in the study, but there were significant correlations between all the variables except for stress and drug problems. One of the more, relationships that you should note in this graph is the relationship between depression and stress, which is a moderate relationship and also highly significant. This is in line with previous studies as well. But you should also note the relationship between depression and drug use as well, which is a low correlation, but still significant nonetheless. Going on to the actual linear regression analysis or analyses that were performed. So this linear regression details the dependent variable depression for all the explanatory variables. I split it up into 3 models. The first one is just demographic variables, so age, SES, sex. And in the second model, I added drug use and substance use problems. And in the last model, I added stress. As you can see from the third model, stress is highly predictive of depression, and it's also significantly correlated with depression as well. Drug use is as well in the second model, although that drops off a little bit in the third model. So going on to the next linear regression analysis where substance use is the dependent variable. Again, the first model was mainly demographic variables, but it was also stress. And as you can see in the first model, stress is highly significant and has a positive effect on substance use. And in the second model, you'll note that stress becomes non-significant and its effect size decreases as well. But when depression is added, it has a positive effect size, and it's also highly associated, or it's highly significant with substance use. So the major finding of this study is that depression seems to act as a mediator between strain and substance use. And at the time of writing, this project seemed to be the first to find this mediation effect. It's also interesting to note that rates of depression among students seem to be in line with past studies, and the relationship between strain and depression also seems to be aligned with previous studies. One of the major implications for the study is that counseling services may be able to use strain as a type of predictor for depression or even substance use if the mediation effect is confirmed. Although the use of prescription opiates was low in the sample, their use was also related to strain and depression as well. It's clear that depression and substance use are still major issues on college campuses, and it's important that more resources be devoted to them so that these major concerns are resolved soon. So regarding future directions, it would certainly be useful if colleges provided more support services for students dealing with strain, depression, and substance use. Naturally, more studies are needed to verify this relationship and ensure that it's applicable to populations outside of the college campus. Future studies could also try to establish a causal order between the three variables outlined in the study. Although there was an attempt to do so, it's limited by the design of the study. So thank you for your interest in my article. I hope you enjoy it and find it as interesting as I did.